I am happy to introduce Lori McManus, occupational therapist from Struthers Parkinson's Center, a Parkinson's Foundation Center of Excellence, as well as Joan Hlas will be joining her as well. So please help me in welcoming Joan and Lori, and a reminder that your packet and the slides are here as well as on the screen. So take it away.
All right. Good morning, everyone. So my name is Lori McManus, and I'm one of the occupational therapists from Struthers Parkinson's Center. And I will be talking about the topic along with Joan Hlas, who's one of our social workers at Struthers. So the topic this morning is recognizing the difficult topics and changes that may occur with Parkinson's disease, and importantly, how to communicate effectively with your loved ones. So I like this quote, and it's true for all of us. The quality of life is determined by our activities. And by activities, those are the things that we do every day, you know, from brushing your teeth to playing a round of golf, and how we enjoy them. So for caregivers and people with Parkinson's alike, it can be difficult to recognize the changes and to deal with them. So it can be frustrating for both your loved one with Parkinson's and yourself. So how do we recognize those changes? So this can be a frustrating journey. You know, how do we separate, is this a Parkinson's disease change or is it just aging? You know, I'm just forgetful, I'm getting old. So I had a patient this week who is in the midst of some changes himself. He's having more trouble walking, he's having a few more falls, he's having trouble with thinking. And he remarked to me, you know, I've worked so hard at managing Parkinson's disease. I exercise, I take my pills on time, I'm speaking loud, I'm doing all those things, and it's catching up with me. And I've realized it's time to accept those changes and move forward with them. And that's a pretty powerful moment to realize that things are changing, but how can we change well with them? So let's talk a little bit about Parkinson's disease and what it is. So we know that it's a neurodegenerative disease, which means that it's a progressive change or decline, and it affects our cells in our brains. And more importantly, it affects the communicator between our cells. So dopamine, which is a neurotransmitter, helps us regulate smooth movement. So these are some of the classic signs that everybody probably initially saw in their diagnosis with Parkinson's disease, or as caregivers that you were able to observe. And oftentimes, caregivers or family members witness these first prior to the person with Parkinson's disease. So the symptoms, I think we're all familiar with: slowness of movement or bradykinesia, rigidity, tremor, and then down the road, maybe trouble with balance and falls. So let's approach Parkinson's disease as we might approach an iceberg. So thank goodness we don't see icebergs in Minnesota. But if we look at it like an iceberg, on the top, you know, what's evident to everybody are those motor symptoms that we just talked about. The slowness, the tremor, the rigidity. Those are pretty evident to people. But then beneath the surface, there's a lot of other changes that may be occurring. And those often can be the most challenging changes, so those non-motor symptoms. Things like changes with thinking or cognition, changes with vision or how we interpret things we see, pain, skin changes, changes in mood or behavior, sleep, fatigue. There's many other changes. Now, your loved one may not be experiencing a lot of these, but they're possibilities. So let's look a little further at this iceberg So I broken it down into 3 main areas. And as an occupational therapist, I work with patients when they come to the clinic on those everyday life activities. So how do you do with getting dressed? How do you do getting in and out of bed? How is it going with your thinking? So all those things that involve your everyday life. So we know that mobility, balance, and postural changes can occur. So movements might appear slower and smaller. They're less automatic. They've lost that automatic pilot. They may have increased difficulty with mobility. They're using a walker, maybe a wheelchair, motor fluctuations, and falls. So personally, I was a caregiver for both my mom and my dad before they passed away. So I do appreciate all of the efforts that go into taking care of your loved ones. And I'm just curious, how many children do we have in the audience? I know I spoke with one earlier. So how many children, or adult children? How many spouses are in the audience? Wonderful. And how many neighbors, friends, or other family members involved? Okay, thank you. But thank you for coming, because, you know, it's an important thing. And I also want to thank all of you who attend therapy appointments and MD appointments, appointments with Joan, because we really do rely on your observations, your intuitions, and that helps us help your loved one even better. So I'm going to talk a little more specifically on cognitive and visual changes. But before that, I want to share just a little story about my dad. So my dad was living in an assisted living facility, and he started to fall. And for me, I put my OT hat on, and I thought, well, I've got to figure this out. What's going on? And so I started, just trying to remember in my head, when he fell, and I knew that was just overwhelming me, and I just couldn't keep track of things. So I started to keep a log. So for me, as a caregiver for my dad, it really helped me to write things out so that later in the journey, if things needed to change, we could approach them as I had a record of things, and I could refresh my memory, and I could use the I statements. I've noticed that you've been falling. And it also helped me figure out why he might be falling. Did it coincide with the time of day, with medications, that sort of thing. So sometimes keeping a record for yourself, to help you sort things out as a caregiver can be quite helpful. So cognitive changes may occur. About 30% of people with Parkinson's may experience changes in cognition. They may be subtle changes, or they may be more significant. So these are some examples of what you might observe. So slowed thinking, difficulty following conversations, and recalling names are pretty common ones. Visual changes may occur. Again, this overall slowness affects our vision and how we interpret vision. Sometimes it can be difficult for our loved ones to judge the space around them. So that's what visual spatial ability means. So that you might see that in everyday life as not being able to negotiate a step well. So they're stepping up and not quite getting it, or missing the curb, sitting in a chair kind of on an angle. I think we've all seen that. So it may be part of a movement change, but it also may be a visual change. So those are signs to look for. All right, here's some other clues to detect some changes in cognition. Now, it's important to remember that these are patterns or trends that you may be noticing. Because sometimes we all have a bad day, or just, forget somebody's name or forget an appointment, and it's not going to be too much of a problem. But when it becomes to, it's more consistent, or maybe you notice it more often, then that's a good time to address that and maybe seek some additional help. So these are some examples of what you might see. So being late or forgetting when people are coming over, difficulty with multitasking, So multitasking is doing more than one thing at once. A good example for that is cooking in the kitchen. Reduced enjoyment with activities. Difficulty with transitions or going from thing to thing, and that can occur in conversation. So as you're having a conversation, if you're talking quickly and jumping from one topic to the next, sometimes that's difficult for people to follow along with. Talking less, repeating themselves, and just limited insight into general safety. So we know that if your loved one wants to, hey, I'm going to hang the Christmas lights out today on the outside of the house with the 10-foot ladder, that may not be a good idea. Visual changes can impact safety. So again, these are some things you might observe or your loved one is reporting to you. So blurred vision may occur, double vision, fatigue with vision. So if they're complaining about, gosh, I'm working so hard to watch the basketball game and my eyes are tired, I just can't do it. Tripping over objects, difficulty finding things, trouble finding someone in a crowd, and just difficulty reading. So visual changes can occur because of how we process that visual information. So when we look at something, we see an image, and then that image needs to be transferred back to our retina. Well, our retinas are lined with dopamine receptor cells. So if there's a lack of dopamine, it's going to change how we're receiving that information. So it's not that they're trying hard not to see something, they simply might not be able to, or it may take them longer to see it. Then that information needs to travel back into different parts of your brain to be interpreted. And oftentimes, that's what causes some changes in visual perception. They see it, but they just can't quite make sense of it. Now, all these changes may reflect in changes that you see in everyday life. So that's usually when I'll start to see patients at Struthers because they may be having some changes with everyday life. So increased difficulty getting in and out of bed, the chairs, the car, slower and less confident with daily routines. So just getting up and getting dressed in the morning. And then changes in tasks that require memory and multiple steps. So they have more difficulty executing tasks. So those are daily tasks like medication management, cooking, and bill paying. So they require a higher level of thinking. So I had another patient this week who was, again, noticing changes. His spouse was working really hard, to let him try to be as independent as possible. But it can be a frustrating journey because your loved one's trying really hard to be independent and you're trying to support that. But this patient was having a huge challenge just getting out of bed in the morning. And his wife was a petite woman, and so she would pull on him, and it was just getting to be a very difficult situation for the both of them. And then he realized, that his wife could be injured. Her shoulders were bothering her. And this was a good time to have a discussion about, do you think it's time for more help? And that can be a critical point because people are working hard at doing things on themselves. And as caregivers, we're trying to support them as much as we can. But this patient realized that I need more help, and I need more help for my wife. So that was an opportunity for me to talk about, well, let's try a little, maybe an aid for a couple hours a week, test the waters a bit. And then it was a good time to refer to Joan, our social worker, who could really help him figure out the nuts and bolts of it. So it doesn't have to be a big change. It can be a gradual change. So as people working with people with Parkinson's disease, we try to stay a step ahead of some of those changes. But we often rely, again, on what a caregiver is seeing and doing. Along with that, here's a few tips that sometimes I'll give patients and families, introducing tools and options to try to improve your independence and trying those sooner rather than later. So using a chair for getting dressed can be helpful for balance, and just simple grab rails in the bathroom. So sometimes simple changes are things as caregivers that we can introduce, and if they're there, they'll use them. The last topic I'm going to talk about, which is a tricky topic for all of us, is driving. So how many of your loved ones are driving? So quite a few. Any concerns about that people have? Or, yeah? And how do you deal with the concerns? Are you able to speak with your loved one about it? Yeah, and I think that's the critical thing. Yeah, it just from initial diagnosis is starting the conversation. So, go ahead. Wonderful. Yep. Yeah, we'll talk about that in a bit, but I think that's a great option because it takes a lot of the stress off you. So driving, if we look at this slide, it can be a pretty confusing scene to people. So we talked about some of those cognitive and visual changes that might occur. If you look at driving, you really have to pull in those domains. And if you're slower, if it's taking you longer to process that information, then this isn't going to go well. This is at the University of Minnesota, so for all those Gophers out there. But driving is such a sign of independence for people, and patients often will remark to me, well, I don't want to give up my keys, and I think a good way to approach when we're looking at driving and talking about driving is we're just gathering some information. We want to see how things are going. What I find is a lot of time people are driving more by themselves. So they're not really driving with people. So nobody really knows how it's really going. You just hope for the best when they leave the house. Here's some clues to detect some potential changes. So maybe a recent car accident, a near miss, other drivers honking at them, and dents or scrapes on the car that you can't account for, and maybe even some damage on your property, maybe a little ding on the garage door or the mailbox. Difficulty with attention and memory that you're noticing other times, and we know that driving, you need to pay really good attention. Difficulty with managing new routes and getting lost. Struggling to back up or maintain their lane position. So again, that leads back to some visual perceptual changes. And then overall slowed reaction time. You have about 1 second to 2 seconds to really safely move your foot from the gas to the brake to manage changes quickly enough. And then the last one is really the biggest one, are family concerns. So when people come into appointments, I always suggest that they bring a family member, because I think patients with Parkinson's disease tend to overestimate their abilities. If I ask them, how's driving going? Fine, no problem. And if I'll look at the spouse, it's a totally different story, right? This was a study done by a physician, a neurologist at the University of Iowa, Dr. Uch, and he does a lot of his practice is studying patients with Parkinson's disease and driving. So these are the changes that he often will see with his patients. So lane violations, turns, stop signs, speed control. Generally, people are going slower rather than faster. Starting and pulling away from the shoulder, and parallel parking. Now, I don't know how much of us parallel park anymore, but it can be tough. Now, here's some approaches to driving. Or, if you're in the midst of wondering, gosh, should I address this? Should we get it tested a little further, like she had mentioned? So I think it's important to discuss it early. Changes with Parkinson's disease and driving may occur earlier than the normal population with aging. So bringing it out in the open early and discussing it as changes occur. So being aware of medication influences, we know that some of the medications our loved ones take can make them drowsy. Are they on or are they off in relation to their Parkinson's medications? And then introducing the concept of retirement and how that relates to driving. So I like to approach it, think of driving and when you're going to choose to retire from driving, like you might from a job, so we all plan for that. We all know that someday that's going to happen. So approach driving in the same direction, and that can make it easier for people to swallow. Riding along with your loved ones, so really getting a feel for how things are going. If you're nervous to drive with your spouse or your dad or your mom, then that's a good sign too that things might be changing. And trying some alternate modes of transportation while they're still driving so they can get familiar with that. So Uber and Lyft, are pretty popular now. Go Grandparent, has anybody heard of that? So it's actually an Uber service, but it's with an operator. Because I think for a lot of us, if you don't have a smartphone or a way to really pull up that ride, this enables you to just make a phone call. So the nice thing about Go Grandparent is you can buy as a daughter or a son or a spouse, you can buy some rides on that. So then it makes it a little easier for that person to take you up on a ride. And then Metro Mobility is a good one too. And then I think another thing that's helpful is to take any defensiveness away is just you're acknowledging your loved one's overall health and safety. And then consider a driving assessment. There's many places that do that. So that gives us an objective view of how things really are going. And sometimes there's a clinical assessment, which we do offer at Struthers, and then there's a behind-the-wheel assessment, like at Courage Center. So there's lots of options in the community that you can use to really get a good picture of that. So so we've talked about some challenging changes that may occur along the journey of Parkinson's disease. And we encourage collaborative care, like the gentleman was saying on the video. So use your team. We're available to help you, and no concern is too small. We have different therapists at Struthers. There's occupational therapists, physical therapists, speech therapists, social work. So please use us, and we do have a handout on the Struthers table that talks a little bit more in detail about what each therapy does. And again, thank you for attending. Now that we've recognized some of the challenges that may occur, how do we talk about them effectively with our loved ones? So now I'm going to turn the mic over to Joan Hlas.
Okay, can you hear me? I have this magic thing coming out of my head here. So there's a reason I recruited Lori to speak with me on this topic, because she did a great job. So let's show her our appreciation. I think therapists have a unique way of kind of breaking it down and looking at the medical aspects of why this happens. They use us as social workers sometimes to help deliver some of the messages, because this is some tough stuff we're sort of talking about. I am grateful you all are here today. I know many of you. It's kind of nice to see faces. I'm better with faces than names. Oh, thank you. But help me out. How many of you are in, let's say, first 3 years of Parkinson's? Okay, so we have some kind of newbies in the crowd, okay? How many of you are in that, 3 to 10 years of Parkinson's? Okay, a few less of that crowd. And then how many of you are our veterans? 10, let's say 10, 15. Do we have any 20-year Parkinson's here? Not quite, Annika. You're 18. Okay. So we have kind of the gamut of who we're working with Parkinson's disease, which I bring that up because it does, it will matter in kind of what you're going to be talking about. So obviously it could be anywhere from how do you start going to medical appointments and start helping with medication and the complication schedules to driving, the all-important topic that no one really wants to talk about, right? So it helps all of us know that nearly 1/3 of adults have difficulty time discussing tough things, okay? I'm a social worker. I've been doing this for a long time. I have tough times bringing up stuff to my parents. I have wonderful parents. They're almost 80 years old. My dad still farms. He's an active guy. When we have to tell him that he can't be climbing into tractors or, God forbid, has to move from the farm, yowza, okay? And not only will it be just tough to bring it up with him, but even the concept of bringing it up to the family, okay? My brothers are probably not going to be like, yeah, let's go chat with Dad. That sounds fun, okay? So, but it's what families have to do. It's what people in our lives have to do. So friends and other people that someone needs to step up and help support us in these tough times and bring up these conversations. So again, driving, moving, accepting help. Even just getting a cleaning person in the home can be really hard for people. We all have standards of what clean looks like to us, and someone is just not going to do it the same way, and that's a big step for people. So recognizing that no matter what it is, big or small, might be difficult for people to talk about. So I'm going to give some tips on that. One of the big reasons it's a challenge is because it's that finding that balance between respecting this person who has lived a wonderful life and probably contributed a great amount to your life, giving them that independence and the dignity. Even though Parkinson's may make them act not quite like the person they've always acted like. I just met with a couple earlier this week, and he actually has a disease called Lewy body dementia, which is very similar to Parkinson's disease as Parkinson's moves on. So it has that dementia component, it has that definitely judgment call. The base of our conversation was more about taking it away from the gentleman who has these neurological changes and blaming it on the disease. Because he and his wife were fighting over every little thing, and she was constantly trying to correct him. I don't blame you. He was tired of her correcting, and she was tired of having to correct. She felt it was necessary, he felt it was unnecessary. You can kind of get the picture, right? So we came up with this strategy to blame it on Mr. Louie. Okay, and I've also came up with a strategy to blame it on Mr. Parkinson's. He's long gone. He can take the blame, okay? So it's separating the idea of the disease process from the person and still trying to give a little dignity along the way. So how do you do this? You prepare yourself. Frankly, the fact that you are giving up a Saturday in December, busy season with snow looming, right? You are preparing, you're getting information. Hopefully you are all taking notes and following, because Lori did a nice job of covering why we sometimes see the challenges, that bottom of the iceberg, right? If it was just the movement problems, it might be a little easier for us. But it's that bottom of the iceberg, the confusion that we might see, the slowness, even the blood pressure changes. You just don't know when they're going to be feeling woozy and have to sit down, the fatigue, all that stuff factors into this. So you start to learn a little bit more. You get the Caring and Coping book, okay? Then it's also, you need to recognize the feelings behind this. Not only the feelings that you're experiencing, there might be some anger, some guilt that you're not addressing these things. We got to talk about this. I don't really want to talk about this, but we got to talk about this. So this urgency to do that, all those feelings you're feeling, but then you got to kind of put yourself in the shoe of your loved one with Parkinson's and how they might be feeling. Their world kind of flipped up along, especially sometimes it's tricky with this long disease that we deal with. Some people will hit bumps along the way, even 2, 3, 4, 5 years into it. Others will float along for a really long time, and then they'll have that bump, and they're like, whoa, what happened? And you're like, well, you've had Parkinson's for 10 years. Did you not expect anything would change? And sometimes it's a complete shock to people that now they have to think about getting help. Now they have to let their spouse do the medications, or they can't drive anymore, even if it's been 12 years of Parkinson's. So I think recognizing your loved one's feelings or your friend's feelings is very, very important. And it really helps prepare you kind of mentally as you think about having these chats. So you got to find the right time for people. So how many of you know that your loved one or your person with Parkinson's has a good time and a bad time? Anybody? Right? Maybe it's all the time, but I don't know. For many people, it might be they do much better in the morning. Things are clicking along, they can get the things done, they're processing better, they're talking better. Other times, it might be midday. We have some night owls, or they think they're night owl, but you have to figure out what works for your loved one. We have the ons and the offs. Does everyone know that expression? On and off. So meds are kicking, things are working, you're on. Things aren't working, you're slow, maybe the tremors kicked in more, maybe the thinking is worse, maybe the voice is worse. That's our off times. You don't want to have a serious conversation with someone when they feel like crap, right? When they're off. So you need to kind of look at what works for the person. When is their on and off? And I know, I've been working with Parkinson's for almost 15 years. It's hard to figure it out sometimes. So it's not a magic, like, oh, it's 2 o'clock right now. This is when we could talk. That maybe worked yesterday, but not today, and that's one of the challenges that people come to. But again, some sort of concept of when they might be on, when they're ready to have this chat. Then you have to figure out who's going to be involved. There are many spouses in the room, and maybe you're the one that steps up and says, okay, I'm going to have this chat. I'm concerned about the driving. I'm concerned about that I'm getting burned out. We need more help. Maybe you're going to do it alone, and that's fine. Maybe you need a team of people. Maybe you have some adult children that you really want to get involved, and they want to be involved. In my family, I brought up my dad, again, who's doing really well, but I am a daddy's girl, okay? So when we have tough things that need to chat about, like redoing the farm trust, yours truly gets to bring that stuff up. Okay, my mom also has macular degeneration, so she's having driving changes. So yours truly was the one that talked to her about nighttime driving. So that's just how relationships work. You figure out who might be those people. So maybe it's adult children, maybe it's a friend, that their best friend is really the person they're going to respond to the best. And they can do it in a little more neutral setting. A lot of times, everybody's emotions kick up. And Paul did a really nice job talking about this village and the idea of forgiveness and working together, but sometimes it's hard to let go past hurts. So if those are going to come up in the midst of your family conversation about changes that need to occur, maybe that's not the right people to be in that conversation. Does that make sense to people? Again, you do what works for your family. Sometimes these are real casual. Like we're having coffee, we're chilling out, we're sitting by the Christmas tree, whatever it is. Sometimes they can be a little bit more formal. So at the Struthers Parkinson Center, I quite often will help facilitate family conversations. And sometimes, again, they're with just the couple, the husband and wife team. Sometimes I have some adult children in there. I have had 10 people sitting around a table. Not my favorite, I'll tell you, okay? Just because it's hard to get everyone to be quiet and respectful and not do side talking and all that kind of fun stuff. But sometimes those formal conversations help to lay a groundwork, and then usually there's homework assignments assigned. You go investigate this, you take a look at that, and you kind of work together. So that might be an option, whether you get your care at Struthers or there are other places that have social workers that may be available. There are even law firms that have social workers that can facilitate some of these conversations, depending on what you're looking at. Again, or some people, my brother's a priest. He's done family conversations with people. So sometimes within religious communities, you can find people that are willing to sit with your family to talk about difficult topics. So you need to be realistic. Again, it depends on what you're bringing up here. So how many of you help manage your loved ones or your person with Parkinson's medications? Okay, that's less than half the room, okay? Now, how many of you recognize, though, that your loved one's medicines might be a little tricky? Like they take multiple pills, 2.5 here, 1.5 here at multiple different times of the day, right? I've seen lists. So it's a challenge. So there may be a time in which it's appropriate for you to say, geez, your medications seem awful tricky, and I'm noticing that you're forgetting certain times of the day. Classic 2 o'clock dose is really challenging for people. They forget that dose. So how do you talk about that? And how do you even start to bring it up? Well, again, it might be a realistic little statement you might make in a loving way of, hey, it's 2:30. Didn't you have a 2 o'clock dose? You know, and just kind of simple, okay, you keep a timer, but you keep that timer and then do the reminder to your wife? Both, yeah. So again, and so it's coming in supportive ways, but there may be a time when it's just you set up the meds together. So it's how do you, again, bring up these small little things that work up maybe to bigger things down the road. You need to focus on tangible things and possible solutions. So again, Lori did a nice job of presenting visual changes. You know, dopamine receptors in the eyes, like people don't realize that. So it isn't they can read eye charts, but then not see a cup that's sitting on the table. And it's just how the dopamine is being processed is the connections. It's very interesting as I work with people with vision. The little tip that I like to give people if they're not sure about depth perception and how that's impacted, look where your loved one puts their cup on the table. A lot of our folks with Parkinson's put it right on the edge. And you're constantly like, geez, move that in. Your elbow's gonna bump that. It's depth perception. So how does that apply to driving? They're hugging the lines, right? Yes? Are you listening? Okay. So dopamine levels. Did you all hear that over here? So, you know, will it vary with the dopamine in the system? It's a great question, Jan. So yes, just like on and offs of everything else, the vision could be factored in there.
My husband has always been a great reader, and now and this was mentioned up here, now he has trouble concentrating. He says his eyes don't work quite right. Other than timing, do you have any other suggestions that would be helpful? Because I think he misses it.
Right. So I would suggest looking at the size of what he's reading. So if there are visual changes, he may be working harder at just scanning the information across a line. So then fatigue sets in too. So looking at high contrast material, so black on white, is going to be easier to see and to follow along with versus, like a light background and a light font.
The magnifying
Black and
glasses
green.
help?
Pardon?
The magnifying glasses help?
Yes, that can help. Even just having a ruler or something to help guide their eyes. So their eyes, Parkinson's disease is a motor disease, and so our eyes have to work together. So sometimes that's shifting a little bit. Their eyes aren't quite working together. There may be blurred vision.
Right.
So following along with the guide helps their eyes follow that, and that can be less fatiguing.
What about a Kindle that you can
Thank
make
you.
print bigger?
That's a great idea too. So a Kindle, a computer where you can magnify the size, you can play around with the contrast, so you're making what they read easier on their eyes. Yeah.
Great tips. Well, and what that, again, it fits right in here. It's very practical things. But it's kind of looking at what are some solutions. You're noticing some changes. What are some things that might be able to help? And that's where Lori made a great point of using a therapist who has the education background to kind of work with people and then individually seeing what they can do, what they can't do. So I think those are great questions and points. Okay, so now we're into, you're going to have the chat about the thing. So again, maybe it's driving, that's the big one. But I talk to a lot of people about how do you even start thinking about getting help. Parkinson's Foundation has had this respite care grant for a while, and it is a beautiful thing. It has helped many people get more support, whether it's in the home or use an adult day program or a stay at a living facility if you're heading out of town for something. But it's not always the person with Parkinson's favorite thing to think about someone else helping them. I don't need someone sitting there staring at me doing nothing, okay? Or I don't want to, go here or do that. Change is hard for everybody, but certainly if you feel like your independence is being pulled from you, it's even harder. So you're at the point, though, you want to think about sitting down and talking about this stuff. I think you kind of make a list of what's important to you. You can't throw everything that's bugging you at a person at one time. So if your list has 20 items on it, you need to narrow that down, okay? Let's pick 2 and go from there, okay? And then you need to make sure that you're not bouncing all over the place. We talked a little bit about the cognitive changes that people experience. A lot of it is lack of attention and focus. So they have to work really hard to stay narrowed in on what you're talking about. So if you start talking about medication management, like let's sit down every Sunday and we're going to set up meds together, and then you're like, oh, but I could use some respite, so how about we hire some help in, or why don't you go to that adult day program? They're like, wait a minute, I thought we were talking about meds over here. So it's kind of one thing at a time, and then, okay, we've got a little plan. So Sunday we're going to do the meds. How can we talk about something else that's been bugging me? And how do we do that? So you need, though, to make sure that you're giving equal time to talking and listening. I have a wonderful, loving husband. I am the talker. He is the listener, and that's how we work. But if I really want to know what's bugging him and really want to hear him, I almost have to sit on my hands and just shut it. It does not necessarily come natural for me, though. And you may be in the same boat. Even if your husband or your loved one with Parkinson's was a talker at one time, Parkinson's slows them down. So you're going to have to, again, whether you sit on your hands, you stick something in your mouth, I don't know what you have to do, you're going to have to just listen and really listen. Listening is a whole different subject to talk about, but there is that idea of listening, and then there's the idea of kind of listening but thinking in your head what you're going to say next, because you got a lot of good arguments. So really listening and giving the time, okay? And then often if you're involving a larger group, there's 5 siblings and a bunch of in-laws, okay, in my family. We've actually ruled out no in-laws involved in parent discussions. That's our family rule, okay? The other family rule that we have is we have to take turns. We're all Irish talkers in the family, okay? So we have to literally, Ed, go, it's your turn. And then the rest of us be quiet. Because we've tried not doing that and it didn't work well. We were all mad at each other and, we got over it quickly. But this idea of a little bit of rules of how we're going to do this, okay? We're going to talk about this for an hour or a half an hour or, kind of a time frame. And then, because kind of conversations can go on and on and on. And it can get difficult for you and I. Now considering you got Parkinson's sitting on you, it can be really difficult for our loved ones with Parkinson's. Be mindful of language. A lot of caregivers talk to me about they are not as patient as they want to be. Is that happening to any of you? Patience is running just a little thinner, right? One sign that patience is running thinner is the tone in our voice. We sometimes get a little louder, we talk a little faster, we get a little more urgent, right? Even if your loved one's having some sort of cognitive difficulties, they pick up on that. They can sense that you are grimacing and struggling even by your tone, your body language, the tone in your voice. So just like I said, you got to hold back and talk. You got to take deep breaths. You got to try to calm yourself. Again, I mentioned that I do family meetings at Struthers, and sometimes I will literally call a timeout. We're all going to go get a cup of coffee or go to the bathroom. Because the pressure and the stress can get too much in these situations. And then nobody's really listening. You're at the person with Parkinson's who's really off and their symptoms are all kicking in. You're not getting anywhere. And now you're just hurting feelings, probably. So really kind of watching that. The other big thing that I have up there is the patronizing speech. You know, it drives me crazy when I hear the baby talk to grown adults. And I think sometimes it just pops out with people not even, I've seen the most caring, loving people do it, and they just don't even realize it. So again, consciously sort of thinking about your speech. You know, I hear sometimes caregivers say, my husband's like a 3-year-old. And though I get aspects of that it can be difficult, your husband is not a 3-year-old. So it's how the mentality of how you bring that into the conversation. Okay? Okay. A couple other things as you're thinking about this, there's the avoiding blame, you know, like, I know this isn't how our life was supposed to be. We were supposed to travel. We were supposed to retire differently than this. Sometimes that can come up. You know, Lori mentioned I statements. You know, she talked about her father and their situation and how she logged things so that if they needed to chat about it later, it was how she felt about it. So I am worried about you. I am feeling burned out. Those kind of things. I worry about our future, so want to be more involved. Not, you need to let me go to the doctor's appointment. Or you need to get more help because I'm fried. Do you see how those have different connotations, right? You know, I need support so we can do this together. Again, and thinking about these ahead of time. If you're in the heat of the moment in a conversation, it's a little trickier to think about the I statements that social worker told me about. So how do you plan ahead for those things is important. Avoid exaggerations. You always do this or you never do that. There has been research and study on people with chronic illnesses that they do become more self-focused. And I think so I'll take the blame a little bit for the medical community. Sometimes we are all about that. Your loved one with Parkinson's comes in, how are you today? How's this going? How's this med working? Are you doing these exercises? Then we go, oh yeah, and how are you as the caregiver, right? So, you know, everyone working together to make sure we're working as a team. It can be very helpful. I'm sorry, I'm just watching my clock here. Okay, so Rosalyn Carter, very famous wife of the president, but she also did a lot of work with caregivers and acknowledging, especially particularly in Alzheimer's, but just to caregivers in general, acknowledging the work that they did. She had this quote that I think is great. Adds perspective to all of us, that whether what position you're in now, there are only 4 kinds of people in the world. Those who have been caregivers, those who are currently are caregivers, those who will be caregivers, and those who will need caregivers. Right? You will find yourself and have found yourself in one of these roles in your life. You might even be in a couple of these roles right now. So even if you're thinking, I got to have this, we got to talk about driving, and he shouldn't be driving anymore, we got to do this. You may be in that hot seat someday. Okay? So it's how, you know, it just gives us a little bit of perspective to the emotions surrounding these tough topics. The other one that I think I'm, again, really glad you're here. I credit caregivers and adult children and friends. And again, Paul did that nice analogy of the village. I want to acknowledge that to make a difference in someone's life, you don't have to be brilliant, rich, beautiful, or perfect. You just have to care. You just have to care. To keep going, to care. That is the end of my talk. Does anyone have any questions? Yes.
Yeah, you mentioned the talking about I feel these, or I do that, or I send.
Oh, I statements? Uh-huh.
Yeah, but what I notice is that a lot of times, even the I statements come across as a you statement.
Yeah. Do you have an example of what you're thinking?
Yeah, I can say, for example, I feel like maybe you should be doing this at this time, or I feel like the pills are not working, or I feel worn out. And especially on that one, it sounds like you are wearing me out.
Actually, I think your last one was probably the best statement, that I feel you should, now you're back right on your loved one. I feel worn out.
Yeah.
That could be you, it could be life in general, we're all aging. I feel worn out. Can you help me with that? And see what she says. Because it is about you. And the other thing to remember is there's no ideal caregiver. There are people that, think they can do everything, but usually they're struggling and hurting on the inside. There are there are people that just can't do it, and then they just leave. There's a lot of people in the middle, okay, where they're doing just fine, but there's certain things that just seem to wear them down a little bit more. And so to recognize I feel worn out, I don't know, I'm just trying to do this every day and trying to figure out how to help you. And then see what she says. She may recognize, yeah, this does get kind of tedious or whatever it may be. I don't know, again, there's no perfect kind of way to say that. I think you're trying. The only one that was a little, the I feel you should was a little bit of trying to tell her what to do, but yeah. Anyone else have comments or questions? Oh, yep.
Getting back to your driving assessment, I did find that it's very helpful to do that driving assessment because they need to hear it from that driving
Yep.
professional,
Yeah.
not the caregiver,
Yes.
not the person who loves them.
Yep.
Yeah, you have to,
It's a
separate
tool. I
yourself.
think I do feel like the family needs to take a role in it, because if you just rely on professionals, frankly, they could pass the test, and you still are sitting over here feeling like they're the worst driver in the world. So if you never bring up your concerns, then you're not getting anywhere, and you're just as frustrated. So I think it's probably
Making that
it's a
decision
combination. Yes,
And then going to the
the
professional.
black and white.
Yeah.
Yep. Very good point.
I had a comment in that the person that I'm the caregiver for is my brother.
Okay.
My younger brother.
Uh huh.
So it's hard to not be the wife and
Yep.
to like coach him and talk to him about what I'm seeing, because I live with them, and what I would like to see him do, and it's a really difficult dynamic being a sibling to a
Yep.
sibling.
Yeah.
I find. I don't know, is anybody else in that same situation?
Any other? I have met others. You're certainly not alone, especially if your brother is a single person and doesn't have that kind of built-in caregiver. A lot of family members do step up, or the siblings do step up. The reality is you still care about your brother. The care might look a little different, but you do care about him, and so I care about you. You're my brother. I want to help you, so how can we work together? I want to do this together.
So I
It's
think
tough.
there's so many more things that he could be doing and embracing,
Mhm.
and it's just frustrating to find my role and where to.
What to do and not to do.
Yeah, this is my other
Other
brother. So
brother.
two of us are here
Okay.
together,
Uh-huh.
so I'm glad we have each other to bounce things
Does your
off
brother
of.
know you're here?
Yes.
Does
Yes.
it, but I bring that up because he may not think he needs the support that he does, but the fact that you guys are here says a lot. So even just to say, we want to help you. Are you willing to let us help you? What does that look like to you?
Mhm.
And that goes for anyone, really. What does it look like to you that I help you? Again, it might look different to him, and I think Lori mentioned it, the people with Parkinson's often don't think they need help, so it's a little tricky, doesn't it? Okay, thank you very much.